This is In Depth. It's that time of year as we approach winter. More of us will be staying indoors in tighter spaces. Well, this time around the block, most of us will not be masked. That's already clear. Just go out and look at the public every day. But there are signals that could be, I should say, a problem. RSV is a virus often associated with pediatrics, and this year it is putting young children into hospital beds. Joining me is our guest health analyst, Dr. David Schultz of Evansville Primary Care. Dr. Schultz, always great to get your perspective on this. What type of virus first is this, and why is it so pervasive, I can guess, this time around?
Well, Brad, RSV is a respiratory virus, and in particular, it affects everybody. Everybody will typically get RSV every year. However, over the last several years, the last 2 or 3 years, we've not seen a large amount of cases of RSV, mainly because we've had a lot of masking and social distancing, and so the cases have dwindled. As a result, the number of antibodies that every individual has are far less. And so we're seeing more cases of RSV this year because children, toddlers, and everybody have less antibodies in their system.
And children, as you know, can be very resilient, growing up very slowly at times, but there are risks for kids who have RSV. Tell me about that.
Absolutely. So children who are at particular risk of RSV are, first of all, asthmatics, those who have chronic lung, those who have immunocompromised states, and those who are prematurely born, the preemies. And they are especially vulnerable because their lungs are not nearly as strong and able to fight off the infection that RSV causes.
And you tell me that older children and even adults, even some seniors, can have RSV. Now, is this more of a latent type of virus in that case, or is it basically what the little ones are getting?
No, it's actually the same virus that the little ones are getting are also affecting our seniors and those who have lots of risk factors like emphysema, COPD, asthma. Our seniors in particular are vulnerable, again, because they do not have the antibodies they've had in years past, and their immune system is weaker than younger individuals. And so as a result, RSV can get in their lungs and cause a very severe bronchitis. And this year in particular, we're seeing even hospitalizations with our seniors from this.
And we've seen some of these nightmare stories where kids are basically on gurneys in emergency rooms, not here in the tri-state, but elsewhere. But how bad is the problem right here at home as far as hospitalizations are concerned?
Well, certainly we're seeing more hospitalizations here, and the number of cases are up around 300% in the tri-state area from RSV alone. So we're seeing a lot of cases, mostly cases that are manageable in the outpatient clinic setting, but certainly we are placing individuals in the hospital, older individuals, and also some of our younger kids.
You know, there's so much stuff out there. Let's just talk about symptoms now. Okay, say like if I have a sinus infection, or if I got postnasal drip, or you mentioned bronchitis, and I'm coughing. I mean, well, it could be COVID, it could be possibly the flu. How do you narrow that down to RSV? What separates that as far as symptoms are concerned?
Well, Brad, it's very difficult to separate those three diseases because they're very similar. Some of the things we look for is, for example, if someone comes in with loss of smell, loss of taste, more likely to be COVID-19. If an individual has very fast onset of symptoms, more likely flu. And those individuals who start with sinus runny nose, clear runny nose, that's more likely to be RSV. But all of these infections will have body aches and may have chills and sweats. And they will often present with fever of 101, and all of them will give perhaps a terrific cough that is usually initially non-productive, but as it carries on, becomes more productive in nature.
And as we have reported, there is a vaccine now in trial stage from Pfizer, but it's clear even if that's approved by the FDA and the CDC, we won't see that until another year. But tell me about that, how that would work.
Well, Brad, this is a breakthrough vaccine that Pfizer has developed. In number one, it's safe, and number two, it's given to pregnant moms in the third trimester. And the mom will develop antibodies that are able to cross over into the placenta and be able to, in effect, inoculate the infant while in utero. And this is important because now we have an infant that's born with the antibodies against RSV from day one. And so the studies that Pfizer has currently released show an 80% reduction in the serious cases of RSV up to 3 months and 70% up to 6 months of age. So this is a breakthrough in that we have now for the littlest and the weakest of our children who are more prone to severe effects from RSV having an effective vaccine.
You know, we have talked about flu, we've talked about COVID, now RSV, and we're treating COVID really like we've been treating flu for decades. This is going to be a seasonal thing as far as not only get your flu shot, but get your COVID shot yearly.
Well, Brad, for the time being, I agree. It will be a seasonal occurrence of getting a COVID-19 vaccine from year to year. And as the new strains come along, they will adjust the vaccine to make it appropriate for that year in particular. The good thing about that is when you get the vaccine, even if the vaccine slightly mutates, it still has enough memory of the original virus that your body has antibodies that can still fight it off effectively. And it may be the difference of a hospitalization, even respiratory distress or failure.
And if you've had your shots as far as COVID shots, even if you get COVID, you're not going to be as bad a shape as if you had not been vaccinated.
And generally that is the case. So those who have had the vaccine for COVID-19 should experience far less symptoms, maybe even minimally symptomatic with the disease, but certainly a far decreased amount of hospitalizations, which again is the goal.
All right, Dr. David Schultz with Evansville Primary Care. As always, thanks a lot for your take on this, and you stay safe and healthy.
Thank you.
All right. Brandon, over to you.
Brad, thank you.